So we now come to the presentations on the fiscal recovery funding proposals. There's a couple of proposals, like 3 from community organizations that were not able to previously present. So we'll hear from them first, I believe, and then we're gonna, or 2 of them, and then we'll move into the county's internally developed proposals.
The speaker will be the Sunrise Community for Recovery and Wellness. Sue, you have 2 minutes.
Hey, my name's Jacqueline Derryberry. I'm actually sitting in for Sue today. I'm the finance director for Sunrise Community. I just wanted to talk a little bit about how over the pandemic that we have seen a very high increase in participants. Yes, we all know that substance use, overdoses, and mental health crises have increased during the pandemic. Just in the last quarter, we've seen 133% increase in participants with Sunrise. So what we're asking for is at the Home is Key project with Homeward Bound, they're asking for Sunrise to duplicate our recovery center within their project. So they're covering the space and all the things needed except for the staffing. So we're wanting to duplicate our center and put it into their project. And also our warm line, pre-COVID, we were getting about 1 or 2 calls a day. And today we're averaging 16 to 20 calls per day. That is currently staffed with our respite staff, which our respite center is up and running, and it's getting to be a little bit unmanageable. So we are partnering with Seek Healing to do the Buncombe County listening line, which will help with capacity for our respite staff. So this funding would also help us to hire more people for that listening line and help our respite staff with their capacity. Thank you.
Thank you.
Our next speaker, I'm not sure if they're on the Firefly gathering. Do we have Marissa or someone on behalf of the Firefly gathering who's going to speak? We'll come back to them. The next speaker will be from Buncombe County and Economic Development. You have 2 minutes.
Good afternoon, Chair and Commissioners. Today I'm here to speak to you about the ARPA proposal for Ferry Road water and sewer infrastructure. As you know, this commission has approved the analysis and site planning for the Ferry Road property, and at your direction, the project's now moving into phase 2. This exciting project supports Buncombe County's 2025 strategic plan and community goals by creating affordable housing, recreational opportunities, and protecting conservation areas. As we move forward, the team will identify potential development scenarios for mixed use, mixed income housing that's supported by recreational and institutional uses. Additionally, as part of that site planning, a detailed evaluation of water, sewer, and transportation access will be conducted to include estimated pricing. This infrastructure is necessary to further improve the site for potential development, but also to meet Buncombe County's strategic plan goals. This application seeks funding for the extension of water and sewer infrastructure throughout the parcel with an estimated cost of $2 million, but additional due diligence is needed and will be conducted in subsequent phases. These types of expenditures are eligible for ARPA funding, and specifically, ARPA allows local governments to use funds for water infrastructure projects that may include building or upgrading facilities, transmission, distribution, and storage systems, including the replacement of service lines. As always, our staff will continue to update the board on progress of the project and more refined costs. Thank you for your time and consideration for this project.
Thank you.
Our next speaker is Election Services, to be followed by Election Services.
Hi there. Good afternoon, Commissioners. I am Corrine Duncan, the Director of Elections, and Election Services is presenting 2 ARPA proposals today. The first is a partnership with the library system to provide remote meeting equipment to poll workers. When the pandemic hit last year, we offered online training for the first time, but unfortunately we ran into inequities in access to technology. And so there were people who either were forced to join in-person training or chose not to continue serving as a poll worker. To address this, we're requesting slightly under $44,000 to add 25 tablets and hotspots to library circulation. This equipment would be reserved for election workers during our training periods, but available to the general public in the interim. Our second proposal is a standalone project to address voting equity in our elderly population. Election Services provides trained teams that visit long-term health care facilities, such as nursing homes, to assist with the absentee voting process. Currently, these teams deliver paper forms to the sites and then bring them back to the office where they're entered electronically. If errors are found, the team has to go back to the facility for another contact with the voter, leaving less time to finish the process. This obviously is not ideal. So if tablets were provided, the online absentee portal could be used instead, and errors or updates could be handled on the spot. We're asking for 5 tablets with data at a cost of $7,039. Thanks for your consideration.
Our next speaker will be HHS. Oh, excuse me. Our next speaker is Emergency Services Community Paramedic Collaborative, to be followed by HHS Active Aging. Claire, you have 2 minutes.
I'm unable to start my video, but I'll go ahead. Good afternoon, commissioners. My name is Claire Hubbard. I'm the program manager for the Community Paramedicine Project, and I'm here on behalf of Buncombe County EMS to talk about a community paramedic and emergency management expansion proposal. As many of you know, right now our paramedic program exists solely as a post-overdose response team that responds in real time to opioid overdoses. And as we approach the 1-year anniversary of our pilot launch, we have a much better idea of what the community and our stakeholders are asking us for. Our ask to expand this program into more than one team is to have the capacity and resources to fill these gaps in care that our community needs and is asking for support in filling, and also to collect unique data that would help our stakeholders zero in on solutions addressing the intersections of homelessness, mental health, and substance use. Lastly, in a larger effort to enhance public safety and meet this strategic goal, we are asking on behalf of our emergency management for a command post and a new air truck to bring us up to speed on disaster preparedness, and also to have the capacity to address public health issues collaboratively in the future for the first time across agencies and stakeholders. And thank you for your time.
Our next speaker is Health and Human Services Active Aging Center. Jen, you have 2 minutes.
Thank you. Good afternoon, commissioners. My name is Jen Teague, and I'm the program manager with Aging and Adult Services, and I'm here to talk to you about the Active Aging Center. Imagine the Family Justice Center. Now envision that same concept meeting the needs of older adults. A one-stop shop for older adults and their caregivers, numerous aging service providers under one roof with a common mission: to empower all people to age in community. The Active Aging Center is a collective impact model approach to creating an intergenerational space to allow older residents the ability to age in place while remaining safe, healthy, and engaged in their community. The center would include a senior center to address the social, mental, and physical needs of older adults, an adult daycare and day health center to provide caregiver support and day programs to those caring for a loved one, a child care center to assist in creating intergenerational opportunities and interactions, a congregate nutrition site and food pantry to address food insecurity in our most vulnerable, staff to assist with housing applications, insurance information services, and community resources, clinical services, including pharmacy assistance, well checks, and vaccination clinics, as well as technology and education classes. American Rescue Plan funds are meant to serve those who had the greatest impact from COVID-19. The National Institute of Health estimated that by the end of 2020, 80% of all U.S. COVID-related deaths were of those age 65 plus. Currently, 27% of residents in Buncombe County are over age 60, and this number is expected to continue to rise. Now is the time to invest in the future of our older adults. Now is the time to show that we value them and that we appreciate them and that we want them to remain an active part of our community. Since 2019, we've been working on this concept, but we haven't done this vision alone. We have many partners at the table like Land of Sky, Mountain Care, Council on Aging, UNC Asheville, and many others. We hope Buncombe County will continue to lead by example in funding this important project. Thank you.
Our next speaker is IT Business Continuity Consulting, followed by IT Continuity of Operations. Eric, you have 2 minutes.
Thank you. Hello, Commissioners. Eric Grau from Buncombe County IT Software Services Manager. I'm here today to speak about continuity of operations services. What do we mean by this? Well, these are plans detailing how to conduct the necessary functions and services of the county in the event of various types of emergencies and threats. What type of emergency threats are we talking about here? This can be anything from a loss of facility, perhaps a power outage, flood, or something even more disastrous. Loss of staffing, in which we faced both of those particular issues during COVID, and even present day, if a staffing office gets hit with a COVID outbreak, what does that mean for the continuity of the services that they provide? Other things like system failures and being in IT, we know about these things, cyber attacks, maybe a loss of a data center or loss of connectivity. So you may ask, don't we have continuity plans already? And the answer is yes, but the last time we put this effort in was before Y2K. That was 1998, we put a lot of this effort in here. And these plans are hopelessly out of date at this point. They're on an on-prem application. And when COVID hit, we looked at these plans and they were not of much value, we'll say that. I'm incredibly proud of the work that the whole county did on COVID response, but we had to go back to the basics of what's essential and what's not essential. And having plans in place will help us to respond to COVID or any type of emergency going forward. From the project perspective, we'd be engaging with a consultant. They'd be doing a business impact analysis across all the departments, inventory of services and their criticality, and other possibilities like seasonal variation. For example, our tax collections department really needs to be, taking tax payments in the early part of January, but maybe in July it's not as big of a deal. So some of that's about response and disaster recovery. So who benefits for this? Obviously staff and management, preparedness and stress levels when responding and confidence, but ultimately it's the citizens that benefit from this program and good response plans to various threats and emergencies. My other one is, I'll just keep this one real short. I'm not sure if I have 2 minutes total. It's around flexible work arrangement and hoteling spaces. So obviously COVID entered a new era of flexible work arrangements, and this request seeks to provide some additional equipment to support hybrid and remote teleworkers. Thank you.
Thank you.
Our next speaker, the next 3 will be Justice Services, 3 proposals. Each one will have 2 minutes.
Hi all, I am going first for Justice Services. Good afternoon, Paulina Mendez, the Family Justice Division Manager, and I'm speaking on behalf of the Collada Family Justice Center application. I do want to start off by thanking you for approving the budget amendment that will allow us to close the bills of funding gap for the services we provide to survivors at the Family Justice Center. That fund's so appreciated, and it will allow us to provide the same level of services we were able to provide at pre-pandemic levels. However, as you know, we are no longer in a pre-pandemic world, and unfortunately, COVID has increased the need for the types of services we provide at the Family Justice Center. We also know that COVID has had a greater impact on communities that have been marginalized. As you may recall from my presentation a few weeks back, the number of survivors we are seeing for the first time is starting to increase back to pre-pandemic levels, but so is the complexity of their cases. The percentage of survivors that are seeing more than one partner agency on their first visit is going up, which means a couple of things. One, it's taking more time and resources on the front end to support the survivors. And 2, we need more time and resources on the back end to support their ongoing needs. These funds would enable us to meet the increased demand for intake, case management, counseling, childcare, and legal assistance by allowing us to provide relief support and ensuring that these services have adequate coverage. The funds would also allow us to reach and support those that have been the most impacted by the pandemic through outreach, community education, and emergency shelter. The need is there and the need is significant. And we know that the impact of intimate partner violence and sexual assault doesn't just stop with the survivor. So thank you for your support of the Family Justice Center, and I hope that you consider the use of these federal relief dollars to help us meet the increased need for services.
Good afternoon. My name is Brent Bailey, and I'm coming on behalf of Jail and Prison Reentry, part of Justice Services Division. And so while a lot of things were on hold and halted during COVID, individuals being released from incarceration back into Buncombe County was not one of those things. Actually, we've seen some increases because people being able to be released a little early due to COVID. So we're asking for funding to continue to expand our service delivery. We would like to add 2 community health workers, and these will be individuals with lived experience. So they'll be certified peer support specialists. They'll have lived experience of incarceration. So they've already shown they know what it is to get out, to have to transition, and they've been successful in that transition. And so they'll be able to help the more recently released navigate not only their transition back into the community, but also navigate the various services they'll be seeking to receive once they are released. So this model has proven to be effective, and that's what we're seeking some funding for, to expand the service delivery, to bring about education and awareness, even as it relates to COVID. We understand in this information age, a lot of people are misinformed. But having people with lived experience just gives them a little bit of somebody to identify with and who they can trust. And so we believe we can latch on to that and be able to improve the information we're providing and education and awareness around that, and even helping people to get vaccinated if needed. And so that's what our proposal is from Jail and Prison Reentry. Thank you.
Thank you.
Good afternoon, Commissioners. I am bringing the last Justice Services proposal, and that's related to our Pretrial Services program. The COVID-19 pandemic created a drastic increase in the workload for our pretrial staff due to the existing backlog in court cases and also the efforts to reduce the jail population. Just this past week, we've had over 200 people referred to us for pretrial, and we have an average of 40 cases coming in a week. We only closed out 175 cases. So as we are seeing an increase in the amount of supervisions because of the case pendencies, we're not closing them out as fast. So this request is seeking 2 additional case managers and a court admin assistant to help us support those that are being released from custody, as well as process the necessary paperwork to ensure that folks are returning back to court. One of the drivers in our jail is failure to appears. And so ensuring that people are notified of their court dates and have the resources to appear in court. Specifically, we want to work towards ensuring that we're giving diligent time to each person, because this really impacts public safety. Currently, the defendants charged with violent crimes represent about 56 of our cases, and intimate partner violence. So Paulina talked about the survivor end. We're supervising about a third of intimate partner violent cases, either felonies or misdemeanors. And so we are asking for these funds to help support our staff in adequately providing resources to address public safety. Thank you.
Our next 2 speakers will be from the Library Services.
Can't seem to share my video. This is Jim Blanton. Good afternoon, everyone. The library as a practice is regularly engaged in community outreach as a core service area. We recognize that residents are not always able to visit library locations due to a variety of potential barriers. The need to meet our residents where they are has never been more apparent than during the pandemic, as those who experience barriers to access were disproportionately impacted. One traditional way libraries have provided outreach is through the use of a bookmobile. Bookmobiles have been a means of taking library services throughout the community to those who need them most, and they've allowed libraries to build relationships and have a presence in underserved communities. While this service model has worked well for libraries, we believe we can expand upon the model to mobilize a variety of county services. The One Buncombe Mobile Services Project will provide multiple county services to underserved communities through the use of two One Buncombe vehicles. The library will lead this pilot program initially to bring services to three subsets of the county: children and educators in child care centers, residents who access services at community engagement mobile markets, and to older adults who live in adult and family care homes. The program will leverage existing relationships through the library's preschool outreach program, community engagement, and adult aging services to bring these services to the disproportionately impacted communities. The library will initially partner with election services to collaborate and cross-train staff to provide select communications, programs, and services that are culturally responsive and developmentally appropriate to each mobile site. This will include everything from the delivery of library materials to registering for library cards, to registering for voting, and to learning more about polling locations and election services in general. As the program expands, there will be opportunities for additional county departments to participate and offer mobile services such as tax, recreation services, permits, and more. The vehicles can also service mobile hotspots in areas of need and will anchor the county's presence at community events. Ultimately, these vehicles will allow the county to meet the needs of the residents where they are and in the places they already go, and provide opportunities to build community relationships and trust. Our second project is the YMI Library Liaison Services Project. With its history as a social and cultural hub, the YMI holds over a century's worth of archival material related to the organization and community. These documents and artifacts include organizational and community history, photographs, and AV materials. Due to present storage conditions, these materials are inaccessible to the community and researchers and are at risk of deterioration. Through this project, the library will provide personnel support, archival storage materials, and the use of its archival collections management system to the YMI to ensure the preservation and accessibility of these unique resources for generations to come. Additionally, we would like to expand on this partnership by developing library services at the YMI. The library will purchase a collection of popular books that visitors to the YMI may borrow, including titles read by the YMI and the library's joint venture, the Black Experience Book Club. Other selections will be made in consultation with the YMI to respond to community needs and interests. A YMI library liaison hired by the library will visit the YMI on a regular schedule to make library cards, answer questions, and distribute information about library programs and services. Providing the YMI and the library with greater opportunities to collaborate and serve community members will improve social determinants of health and quality of life for everyone both institutions serve. Increased access to libraries not only provides individuals with books to check out for lifelong learning and pleasure, but also free internet and computer access, early learning and socialization opportunities for children, free classes and activities for people at all stages of life, assistance with research, and an entry point for other county services. Similarly, providing access to YMI's historical materials will create opportunities for community members and outside researchers to disrupt traumatic narratives and build a more comprehensive understanding of our shared past. Thank you.
Thank you.
The next project will be from Strategy and Innovation, to be followed by Planning.
Hi, good afternoon, commissioners. This is Heather Parkinson with Strategy and Innovation, talking to you all today about the request for outfitting conference rooms with hybrid meeting technology. So the request is to outfit 40 conference rooms across county buildings with technology that assists in accommodating hybrid meetings, such as this one. And the technology would be utilized and is currently utilized for internal and external business operations. Buncombe County doesn't currently have the technology to support hybrid meetings in all county buildings. And the reality is that this is our new normal. We're over 1.5 years into a pandemic, and hybrid meetings are common across not just Buncombe County, but all industries and used for multiple purposes, and our customers have come to expect it. So this proposal is to cover the cost of the audiovisual solution, which includes microphones, speakers, and cameras. And the technology can be utilized over multiple platforms, meaning it can be used with Zoom, Teams, GoToMeetings, etc. So why is it important? Going back to what Eric spoke with you about earlier, it ensures continuity of operations. It puts that infrastructure in place so that we can collaborate for not just this current pandemic, this current emergency, but any future emergencies where social distancing or even travel is an issue. The reality is that we will always need to have some staff to be physically present, but we don't want all to be present for various reasons. So having the technology in place for hybrid meetings and also trainings allows Buncombe County to be able to respond to emergencies despite physical barriers. Thank you.
Thank you.
The next two projects are from planning.
Good afternoon, Commissioners. This is Matt Cable, Buncombe County Community Development Division Manager. Thank you for the opportunity to present information to you regarding the Planning Department's two separate applications. The first request is to support a project known as the Home Repair and Supportive Services for Low-Income Residents project. Two important components of this request are, first, the scalability of the project. This project can be implemented with virtually any level of funding support that would be received. And secondly, the shovel-ready nature of the project. This project could be implemented quickly to begin creating immediate community impact. Planning Department Community Development Division staff were compelled to submit a request for funding for this project based on the observed, sustained, and ongoing need for home repair for low-income residents in Buncombe County. To date, Buncombe County's Affordable Housing Services Program has committed over $2.3 million in local funds through emergency repair grant funding. These funds have impacted over 400 low-income households and will ultimately impact at least another 76 households in the upcoming fiscal year. Of the $2.3 million awarded to this effort, over $1.2 million in emergency repair funds have been authorized and approved by the Board of Commissioners in the last 3 fiscal years. Despite the increased commitment of local funds to meet the emergency repair need, the annual combined wait lists maintained by our community partners in each of the last 3 fiscal years continued to exceed 75 households, again indicating the persistent need. Regarding the specific project proposal at hand, it is important to note that since the time of staff's initial application, additional information has become available which impact the total funding requested and needed. For example, we understood the original project delivery timeframe to have a longer duration. Since submitting the application, we understand that this project delivery timeframe is more constrained. Staff now anticipates a maximum award of $2 million would be reasonable for project delivery within these time constraints. The second of the two projects is known as Property Acquisition for Affordable Housing. Two important components of this request are, again, the scalability of this project. The project could be implemented at various levels of funding to acquire as many as 10 and as few as 1 properties. And second, that a property acquisition effort will allow for preservation of properties well suited for affordable housing development. Community Development Division staff were compelled to submit a request for funding for this project based on an understanding of project constraints made apparent during recurring annual Affordable Housing Services program cycles. Repeatedly, the first hurdle for entities interested in developing affordable housing units using both local and external funding sources, like low-income housing tax credits, is the ability to procure a property during timeframes that correspond with award cycles. Viable projects can be abandoned when property owners decide they no longer wish to remain under sales contracts for extended periods, as tax credit awards are sought or local funding is requested year upon year. Property acquisition is a major upfront cost for affordable housing development, particularly in Buncombe County. It is anticipated that appropriately sized and located properties suitable for affordable housing will cost between $1 and $2.5 million per parcel. Staff requested $10 million in funds for the purposes of acquiring properties which will be used to preserve and deploy sites ideal for developing affordable rental, for sale, or transitional housing. The project does not anticipate Buncombe County would directly develop or redevelop acquired properties, but rather that Buncombe County will acquire the properties and thereafter seek development partners to deliver affordable or transitional housing serving low-income Buncombe County residents. Thank you.
Thank you.
Our next 7 projects will be presented by Recreation Services. You have 14 minutes.
Sorry, and good afternoon. Thank you for the opportunity to speak about our recreation services projects. I'm Peyton O'Connor, the Buncombe County Parks and Recreation Director. If you'll first allow me to set the stage for our vision of COVID recovery through enhanced recreation facilities before speaking on the specifics of each proposal. So over the last 20 months, we've learned more than ever that providing safe, equitable, handicap accessible parks is essential for our community's resiliency, health, and well-being. Our parks and the team members who manage them are vital to our community as we continue to navigate the COVID-19 pandemic and bring to light the urgent need for substantive dialogue about systemic inequality with real change and response. Buncombe County has been the trusted steward of our county's parkland for decades and continues to serve the public by protecting and preserving a unique collection of spaces in which we see as essential infrastructure and a core service to the people of Buncombe County. As an organization, we champion inclusiveness, social equity, and mutual trust. We believe our community is a better place when everyone from infants to retirees has the opportunity to be strong, healthy, and successful. Our projects and programming represent a primary goal of low cost, inclusive, wellness, and active living opportunities that are accessible to all residents, regardless of cultural, physical, cognitive, or socioeconomic background, to create a livable, healthy, and vibrant community. What does this look like in a post-pandemic world? We cannot solve our problems with the same thinking that we used to create them. As the coronavirus pandemic shut everything down, the one avenue to maintaining people's physical and mental well-being were parks, open spaces, greenways, and trails. The increased usage we've seen, which has resulted in more than twice as many visitors as at some of our parks, has already resulted in increased advocacy. Hopefully, it will also result in increased funding as community members expect our leaders to embrace the goal of everyone having access to a quality park within a 10-minute walk of a home as a standard minimum. It is well documented that years of neglect and divestment have saddled our lowest income neighborhoods, more exposed to pollution, natural disasters, such as flooding, and health disparities from climate change. Our neighbors in these areas lack access to safe open spaces. There are not safe connections to existing resources by way of sidewalks, greenways, and multimodal transit lines. Parks drive economic activity in their communities and serve as a source of civic pride, fostering communities and mountain spirit. Lack of parks has the opposite effect. The time is now. Many public comments have acknowledged that the outsized roles that parks have played during the pandemic and will continue to play in the long-term future. The question is, will we pay back parks by investing in open spaces where people can exercise for no or little cost, supporting places for hurried individuals to reconnect with nature, and creating safe community gathering spaces to connect with neighbors and preserve culture? We've heard from nurses, teachers, grocery store workers, parents, and other community members deemed essential during the pandemic. These essential workers say parks, playgrounds, basketball courts, and greenways have been essential for their personal, physical, and mental well-being over the past 20 months. Will we pay them back by investing in our park system? When combined with the ability to deliver healthy, happier, more equitable communities, parks and recreation's powerful economic impact highlights the fact that our agents' offerings are not merely a nice-to-have luxury government service. Instead, parks and recreation transform our cities, towns, and counties into vibrant and prosperous neighborhoods for all. They are vital for the return to normalcy. It is not enough to expect to build a park and expect people to come. For-profit amusement and recreation entities such as Biltmore, Navitat, and local outdoor outfitters are focused on user experience, but those are not options for many residents from low-income households. In fact, kayaking the French Broad River, exploring a nature trail, or even just visiting a park can be a bucket list item for anyone who lives within a mile of these experiences. Buncombe County's public parks and safe connections to nearby low-income in majority minority neighborhoods via greenways, sidewalks, bike lanes, and natural trails represent the promise of welcoming spaces and equal access for all. In many communities that have seen disinvestment, parks are ground zero for civic commitments to be made or broken. We demonstrate care through asking residents what they need and delivering on those commitments. Buncombe County's Parks, Recreation, and Greenways Advisory Board identified several valuable community projects based on data and best practices from the National Recreation and Parks Association Public Policy and Advocacy Team, a group that worked closely and diligently to help align the American Rescue Plan Act of 2021 passed by Congress and quickly signed by President Joe Biden, using evidence-based studies linking greener parks and green infrastructure to better health outcomes. We believe these projects to align with the pillars of the Buncombe 2025 plan and deserving of high scores using the rubric provided by the county for American Rescue Plan Act funds. Additionally, parks have been identified by Buncombe County emergency operations and public health leaders as locations that can act as emergency shelter and health care locations during times of crisis, such as the coronavirus pandemic. In fact, the Buncombe County Sports Park was the site of a long-running drive-through vaccination clinic because of the sizable Latinx and Hispanic community members living within a radius of the park. The Department of Treasury has also clarified that the American Rescue Plan funds can be used to address maintenance and upkeep issues because of the increased use parks saw during the pandemic to improve spaces like our facilities that have been disproportionately impacted by COVID-19. The greatest impact on parks in the foreseeable future will be overcrowding. Within our department, we use a tier-based system to determine service level and self-sustaining cost recovery. Tier 1 projects represent amenities that are free and open to all. This is the bare minimum that should be acceptable in Buncombe County parks and facilities. Things like playgrounds, public river access, basketball courts, greenways, walking trails, and similar items fall into this category and represent the lion's share of our ask today. Tier 2 projects include baseball and softball and t-ball fields, soccer, lacrosse, and field hockey fields, and access to fishing or placing watercraft on Lake Julian are other projects in which we recover some of costs maintaining our facilities, but have determined the entire cost recovery would lead to increased inequities. Tier 3 recreation represents total cost recoveries and includes picnic shelter rentals, full park rentals, events like Festival of Lights, and other opportunities in which the entire space and staff time is covered. These opportunities are well below market value, but allow family, friends, and organizations low-cost chances to safely meet others beyond basic offerings. As we solicit RFPs from multiple vendors pursuant to Buncombe County policy, an emphasis will be placed on engaging companies with women, BIPOC, an acronym for Black, Indigenous, People of Color, and LGBTQIA owners. Projects with investment initiatives in multiple tiers. That project includes accessibility, safety, and equity, facility usability upgrades. That's priced at just over $1 million and involves replacement and retrofitting of core infrastructure at parks, pools, and other facilities to better handle overburdened demand that has been further exacerbated by increased visitors and strain during the pandemic. All of the upgrades and retrofits will affect buildings and equipment that are 25 plus years old, far beyond the intended lifetime usage. New restrooms and additional covered picnic shelter pavilions and expanded natural play areas with handicap accessible benches continue to rank as the top requests from park users behind greenways. The 3 new outdoor classrooms, one at each of our regional parks, to allow youth learning and wellness classes that are critical to child development and foster mountain spirit, imagination, and creativity, along with healthy habits, teamwork, social equity, emotional stability, and environmental responsibilities. These spaces can be rented for outdoor fitness classes to retirees actively aging in our community and others who prefer to exercise outdoors. We're also including the restroom facilities at Lake Julian and replacing those with single stall facilities to better serve families with small children, members of the LGBTQIA community, and other visitors. replacement of the restroom concession stand building at the Charles D. Owen Park and North Buncombe Sports Complex to bring the concession areas up to code and to transition to single-stall facilities for the reasons just spoken about. And additional restroom facilities at the Buncombe County Sports Park. 8 new sites built covered picnic shelters, and replacement of the 10 shade structures at each of our pools. We're also including 60 new accessible park benches throughout our system and 10 new accessible rocking benches spread throughout our parks. Within our Tier 1 projects, we've got resurfacing and replacement of the outdoor basketball courts at Charles D. Owen Park and Hominy Valley Park, and that's just over $215,000. Electric gates at Buncombe County Sports Park and Charles D. Owen Park with a price tag of just over $40,000. One thing that we realized throughout the pandemic is the ability to restrict access to the parks in order to allow them allow the county to respond to public health crises, as well as to allow us to shift operations during emergencies, is a major need for our park system throughout. We've included an inclusive playground at Cane Creek Park that's priced at $100,000. This is adding a new play feature in a underserved area of our community and would involve the replacement of a playground that's 20 plus years old in that community. We've also included an initiative to place solar powered trash compactors and recycling bins, 20 at the Buncombe County Sports Park, 14 at Charles D. Owen, and 6 at Lake Julian. That project is valued at over $280,000. And it's a critical need at Charles D. Owen. Throughout the pandemic, with increased usage at that facility, we increasingly saw waste demands higher than what we were able to service with traditional trash system. And our final 2 projects are the Bent Creek Greenway, which has a price tag of $8 million. The Bent Creek Greenway is roughly a 12-mile greenway that will begin at the terminus, the city of Asheville's French Broad River Greenway, and connect all the way to Lake Julian Park. It will connect the Western North Carolina Farmers Market, Asheville Outlets, Bent Creek River Park, and the neighborhoods along Brevard Road, along with the new Ferry Road Development Project, Biltmore Park, and Lake Julian Parks. This has been identified as one of the 8 priority corridors listed within the original Buncombe County Springway Master Plan. We're also requesting an additional $2 million for the Highway 251 and Beaver Dam Creek Greenways, which has recently been combined into one project referred to as the Woodfin Greenway. It's part of a larger recreation destination that I'm sure you're all aware of. It will connect to the city of Asheville's Rad Tip Greenway, and will also connect to the new Silverline Park in Woodfin, along with the Whitewater Wave. It will bring together the Woodfin River Park, the Rivermount businesses, the French Broad River Academy, and the Reynolds Village area. This is a roughly 5-mile stretch of greenway that will begin at the corner of Broadway and Riverside Drive, and it'll follow along the river through Woodfin up to the MSD plant, and then it'll cut across Beaver Dam Creek to Merriman Avenue. So I appreciate you taking your time to listen to me for so long, and thank you for your consideration of these projects.
All right, thanks, Peyton.
Our last speaker, if they are here, is the Firefly Gathering. I am not certain that I see them here, but just wanted to circle back in case they joined. With that, it concludes our public comment.
All right, thank you very much to all the community and county folks who presented today. Great job to everyone. Great summaries of a lot of really compelling projects. Appreciate it. All right, Avril, is there anything else we need to address during the?
I do have one correction I need to make to a statement that Raphael made earlier.
Okay.
He said there were 6 current employees at Asheville. We were not counting supervisors. There are actually 8 telecommunicators and 2 supervisors currently working. Instead of 6, there are actually 10 employees. So I just want to make sure we correct that.
All right, commissioners, any other questions before we adjourn? All right, let's go ahead and adjourn this meeting. We'll start again at 5 o'clock for the regular meeting.